How much water should I really be drinking per day? Takeaways to remember. Your body requires a sufficient quantity of water in order to survive. You should drink enough water to meet your specific needs rather than following the 8 glasses of water a day norm. Overhydration is an uncommon but important medical problem. You've probably heard how vital it is to drink water and how essential it is for living things to survive. But, do you really need to drink 8 glasses of water every day, as is commonly advised? Furthermore, what are the true advantages of water? We'll distinguish reality from myth about how much water you need in this piece, as well as how to assess if you're getting enough. What are the benefits of drinking water? Water makes up around 60% of the human body. This vital vitamin is required by your body. In fact, you couldn't survive without water for more than a few days. Here are just a handful of water's numerous advantages. Water is beneficial. Maintain a comfortable temperature. Maintain a healthy mouth. Protect your delicate tissues by lubricating your joints. Urine, sweat, and feces are all ways to get rid of hazardous waste. Your blood transports nourishment to your organs. Do I really need to drink 2 liters of water a day? No, there is no proof that you should drink 8 glasses of water a day, or 2 liters. According to studies, the majority of individuals obtain enough water through the meals and drinks they consume on a daily basis. Water is present in all beverages, including tea, coffee, juice, and soda. These beverages, together with plain water, account for 70 to 80% of most people's overall fluid consumption. Food accounts for the remaining 20 to 30% of most people's overall fluid consumption. Drinking sugary beverages, on the other hand, should be limited. Sugary beverages, such as soda, can harm your health and cause obesity, diabetes, and heart disease. As a result, plain water is frequently the healthiest hydration option. Other common myths about drinking water. The popularity of water has led to a number of myths about why you should drink more of it. We'll look at 3 prevalent water misconceptions below. 1. Myth: drinking more water will improve your skin. You've probably heard that drinking more water will help with skin issues. However, it is uncertain whether or not this is correct. For example, according to a 2018 assessment of the research, drinking more water can help your skin stay hydrated. However, the researchers acknowledge that additional study is needed to fully understand this link and if it might help minimize the indications of dry skin, such as wrinkles and roughness. 2. Myth: drinking more water will improve your kidney function. Finally, there is no evidence that increased water consumption improves renal function. No matter how much water you consume, your kidneys are already experts at regulating the water in your body. The kidney's major job is to keep the body's water, salt, and mineral balance in check while also eliminating waste. This allows your body to function at its optimum. Your pee grows concentrated and darker when you don't drink enough. You'll find that as you drink more water, your urine becomes cleaner and whiter. Both of these signs indicate that your kidneys are in great functional order. Your kidneys are only put under stress when you're sick, such as when you're clinically dehydrated. 3. Myth: drinking more water will help you lose weight. Water has no effect on weight reduction. However, a recent research suggests that drinking water before meals may aid with appetite control. As an indirect advantage of drinking water before eating, you may feel fuller quicker, have less food cravings, and lose weight. Additionally, consuming more water rather than juice, soda, wine, or other sugary beverages may help you lose weight and enhance your overall health. How much water should I be drinking daily? There is no hard and fast rule for how much water you should drink. It will differ from person to person. The National Academy's Institute of Medicine, on the other hand, determined males who are well hydrated consume roughly 3.7 liters, 125 ounces, of water each day. Females who are well hydrated consume roughly 2.7 liters, 91 ounces, of water each day. Some people, however, may require more water than others. This is dependent on a number of things, which we will discuss next. Because nearly 2/3 of the adult body is made up of water, those with a higher body weight may require more liquids. If you live in a hot, dry climate, you may need to drink extra water to replenish fluids lost via sweating. During the hottest months of the year, you may need to drink extra water. Physical exercise, such as jogging and weightlifting, can cause you to perspire and lose fluids. Stay hydrated by increasing your fluid intake, especially if you're exercising in hot weather or at high elevations. Fever, vomiting, diarrhea, kidney stones, bladder infections, and illnesses that produce excessive urine, such as diabetes, are all examples of health disorders that can induce fluid loss. Most people's usual drinking and eating habits suffice to fulfill their body's water requirements. This suggests you're probably receiving enough water if you drink fluids when you're thirsty. Unless your healthcare practitioner tells you differently, you don't need to be concerned about your water consumption. How to tell if your body is getting enough water? Examining the color of your urine is a simple technique to see if you're receiving enough water. Urine should usually be clear or pale yellow in hue. It might be a hint that you need to drink more water if your urine is dark yellow, brown, or amber in color. Dehydration occurs when the body does not have enough water to carry out its usual processes as a result of not drinking enough water. Mild to moderate dehydration is usually treated by just drinking additional water. Here are some symptoms of mild to severe dehydration, which are your body's way of reminding you to drink more water. Dark or strong smelling urine. Dry mouth. Thirst. Headaches. Less frequent urination. Muscle cramps. You may find yourself in a scenario where you are unable to retain enough water to effectively rehydrate yourself. This happens when you don't drink or eat enough to fulfill your body's requirements. You could, for example, have a medical condition that makes it difficult for you to drink enough water. These are the most common ailments that affect you. Brain, like dementia. Mouth, like mouth inflammation or cancer. Swallowing, like a stroke. Alternatively, you can lose more water than you can restore by drinking. If you have a bad infection with a high fever, vomiting, or diarrhea that won't stop, this can happen. It may also occur if you have a medical condition or are taking a prescription that causes you to urinate frequently. Depending on the scenario, your healthcare professional may prescribe oral replacement treatments or an infusion into your vein to restore fluids. Rehydration treatments not only replenish water, but also critical electrolytes like sodium and potassium. Is it possible to drink too much water? It is possible to drink too much water, albeit this is uncommon. Overhydration is most commonly associated fault with athletes who drink excessively during heavy exertion to avoid dehydration. People with illnesses that cause their bodies to retain water, such as heart failure and renal dysfunction. People who have underlying medical issues that induce extreme thirst and force them to drink excessive amounts of water. Hyponatremia is a condition caused by dehydration. Hyponatremia is a condition in which the body lacks sodium, which is a crucial electrolyte for fluid balance. As a consequence, fluid causes your body's cells, particularly those in your brain, to enlarge. The following are some of the harmful symptoms that might occur as a result of this condition. Changes to your mental state like confusion or irritability. Fatigue. Headaches. Seizures. Nausea and vomiting. Muscle cramps or weakness. Coma. Consult your doctor to check whether you're at a higher risk of dehydration. If that's the case, you and your partner can figure out how much fluid you need to drink each day to keep healthy and hydrated. Last but not least, most people are fully hydrated if they drink water according to their thirst. As a result, it's preferable to listen to your body rather than counting how many glasses of water you've consumed. If you have a medical problem or are concerned that you aren't drinking enough water, get advice from your healthcare professional. Although you may acquire water from a variety of beverages and foods, drinking plain water is the best option. Finally, keep in mind that water is good for every area of your body, and it's unusual to drink too much of it. Disclaimer: this article is solely meant to provide general information and does not address specific circumstances. It is not a substitute for professional advice or assistance, and it should not be used to make any judgments. For the diagnosis and treatment of any medical issues, a professional physician should be consulted. Any decisions you make based on the information in this report are your own. If you're looking for weight loss secrets, have a look at this.